There's a part of the month that is called peak season in the midwifery profession, depending on your country, and we have one in Ghana as well. During this time, a lot of women come to deliver, and you can have multiple deliveries on a shift, to the extent that maybe you would have to make some women, move from ward to ward, and the whole place can be choked. Gone were the days where you would have people even lying on the floor with their babies on mattresses because there will be no bed space for them. So during one of these seasons years ago, then we came on a night shift. Interesting enough, I was there with a junior cleaner, and that shift was a very busy shift. But we ended up having about 6 or 5 deliveries, and this was at our outpatient department. So now it's left with me and my junior staff, and we needed to do our documentation. So the morning came and people came in, everybody was fine. Hello, hi, how was the night? It was okay. And I told my junior staff, we need to write our nurse's note before leaving. And she was like, nursing is a continuous job. Why can't we just hand over and go? Then I had to tell her a story in this incident, and that is what I'm about to talk about. I once came for a duty where I was not in the place where they do delivery, but I happened to be there, and I was just washing my hands, and the patient was shouting my baby was coming, and immediately I grabbed gloves and I delivered the baby. Unfortunately, this child was a baby who was coming out with a fetal abnormality and had come in, has not been assessed or anything. So immediately the baby came out. As usual, we always deliver babies onto their mother's abdomen, so I did that onto the mother's abdomen, but unfortunately that baby didn't get live based on the fetal abnormality the woman came with. And then I handed over and I left. I woke up to a call from my matron who wanted to find out from me what happened. Apparently, the husband to the patient had come with a policeman demanding for their baby. And there came my shock. Like, what baby? I left the baby on the mother, and though the baby was dead, I handed over and everybody knew the baby was gone. And that was where they told me of the fetal abnormality. She was asked to go and do a scan, and she just came in and was lying there, and I came to see her pushed in the ER. So then I had to rush back to the hospital to find out what was on the note. So, not knowing the note was not properly written, someone had written the note with my name beneath. But what saved me is my matron knowing who I am and how I write my note. So immediately she saw it, she just said, this note was not written by Saada, and this is not even her handwriting. I mean, if you know me and you know my handwriting, you don't want to talk about it. Fast forward, I went to see the labor chart, and I noticed the lady didn't really write anything. So I took up the labor chart myself, and I had to write what exactly happened and all that I did, showing the baby to the mother, which she even refused to see. And I had to leave the baby by her side, and I handed over for them to continue. The lesson I learned from this incident was that when it comes to mother and baby, after delivery, I prefer to write my own labor notes. And afterwards, every other work can be handed over, because nobody can account for the action of delivery like I will do, being the one who delivered the baby. So that day, I told Veronica that we have to write our notes. And even if we leave here at 10 a.m. in the morning, we'll go home sleeping in peace. Vero, if you're watching me, you know this. And based on the lessons we learned, is for us to be accountable for our actions and do our work diligently.